Welcome to Accommodate This. My name is David, and I'm a late diagnosed autistic adult. I make videos about autism and the neurodivergent experience, so if that's something you're interested in, please be sure to subscribe so you don't miss out on any future content. It's quite common for people to mistakenly place autism in the same category as an illness or disease. To most people, even the words illness and disease are somewhat interchangeable. But in the medical world, the definitions for an illness and a disease are distinctly different. And in this video, I'd like to discuss the differences between those words and a few others, so that you might be able to understand autism and other developmental conditions a little bit better. And now that you know why we're here, let's get into the topic for this video: categorizing autism. Humans like to categorize things, especially autistic humans. And autism is categorized as a neurodevelopmental disorder. Now, while there's a lot of stigma attached to labels, categories like this can provide quite a bit of helpful information to the medical community who may be expected to provide support or treatment. The world of medicine can be quite time sensitive, so the ability to communicate a lot of information concisely can make all the difference in a person's life. Now, these categories not only help providers to treat patients, but are also used to help standardize and regulate processes or to litigate issues of a medical nature. Furthermore, having a single universal language is quite handy, considering it reduces the chances of making a mistake or miscommunicating, especially when people travel throughout the world. But what does the category of neurodevelopmental disorder tell us about the condition of autism? First, let's define condition. Condition is a general term describing the state of a person's health. So usually condition implies a state that is different from a normal state of well-being. But it doesn't always have to be bad. It can also refer to a perfectly normal state, like pregnancy. But when there is an issue, labeling it with a condition can be a really concise way to inform others of a person's health, and in turn, the urgency and level of treatment that they might need. For example, when you're in a hospital, there are 7 basic states that providers use to describe their patients. Undetermined, and this is used when someone is waiting for evaluation and their condition is not yet available. Then there's good condition, and this is used when someone is in good condition. It means that they are conscious and they're comfortable, and they have vital signs that are stable and normal, and all indicators for them are pretty much excellent. Then there's fair. So when someone is in a fair condition, they're conscious, but they're experiencing some minor complications. Vital signs are stable and normal, and indicators are favorable, not necessarily excellent. Serious condition is when someone is acutely ill. Indicators are questionable, and vital signs may be unstable or not within normal limits. When they are in critical condition, that's when someone is acutely ill with major complications. Vital signs are going to be unstable and not within normal limits, and patients may not be conscious in this state. Most of the indicators are unfavorable when someone is in critical condition. The next condition is deceased. Basically, they're dead. But this is used when someone has no vital signs. And then treated and transferred. This is when someone may have received some treatment and has been transferred to a different facility. Those are the 7 basic conditions or statuses that are used in a hospital setting. And conditions can also be acute or chronic, which speaks to their onset, their duration, and their treatment. Acute conditions appear suddenly, last for a short period of time, like days or weeks, and may require immediate treatment to address the symptoms. For example, a broken arm, a cold, or an allergic reaction. These are all considered acute. On the other hand, chronic conditions develop slowly over time. They're usually long-lasting, like in terms of months, years, or even a lifetime. And they don't easily come about or go away quickly. Chronic conditions usually require some ongoing form of treatment to manage the condition, or lifestyle changes in order to control the symptoms. So for example, this would be like diabetes, heart disease, arthritis, or high blood pressure. Acute and chronic generally speak to the onset of a condition, but there are additional terms that we use to describe how the condition developed. For example, if a condition is developmental, then the condition is present at all stages of growth, from conception to death. And there are subcategories within the developmental category, and those point to more specific stages or specific regions of the body. For example, congenital is a subcategory that describes a condition that is present at birth, okay, regardless of its cause. Autism is a neurodevelopmental condition, which means it is present throughout every stage of development, from conception to death. The neuro part refers to the nervous system, which includes the brain, spinal column, nerves, and so on. So when they say autism is a neurodevelopmental condition, that means it's a condition of the nervous system that is present at all stages of life, from conception to death. And this is why there's no cure for autism, and why we say it's a lifelong condition. Developmental conditions can be further broken down by their cause. For instance, when a condition is genetic, it is due to a mutation within the person's genes or DNA. And genetic conditions may be present at birth or congenital, or they can develop later in life. However, if the same mutation was passed on from the parents, it's known as hereditary, which simply means it's something that can be inherited from either your parents or passed on through your genes. Now, heredity is essentially a subcategory of a genetic condition. Both impact genes or DNA, but only some genetic conditions are inherited. Other genetic conditions develop when mutations occur during replication of DNA. So while genetics are considered the primary contributor to autism, environmental factors also play a role in its development. Since multiple genes are involved, it's not as easy as saying it's hereditary. Several factors are at play here, and they need to line up just so in order to result in a person being autistic. So for example, identical twins, they share the same DNA, but they only have a 60 to 90% chance of both of them being autistic if one of them is. And the risk for fraternal twins both being autistic is around 3 to 31%. At the same time, there is a hereditary link because studies have shown that autism tends to run in families. So those with a family history of autism are at higher risk of being autistic as well, but it's not a guarantee. Now, I've discussed the neurodevelopmental part at length, and you can also watch my video on brain development for additional information about that process. But let's now talk about the disorder part of the condition. For this segment, there are 3 basic categories that we need to discuss: disease, disorder, and syndrome. And these are basically a hierarchy of conditions. A disease refers to a specific diagnosable medical condition with identifiable signs and symptoms. Essentially, disease is the medical condition, and it's usually taking you away from what is normal for you. So when you have a disease, you typically have a specific issue that your healthcare provider can diagnose. Diseases are considered pathological, which is just a fancy word for a condition that's markedly abnormal. It's different from what you're used to. And in order to be categorized as a disease, there needs to be an objective way for a provider to see, touch, and measure it. Diseases have particular signs and symptoms known to the medical profession. Now, that's the most specific category of the three. So let's zoom out to disorder, which describes a condition or a collection of symptoms that is different from normal function, but the cause of the disorder may be unknown. A disorder may describe a functional impairment, a disruption to the body's normal function, or to a variation in structure. And it doesn't have to be necessarily brought on and take you away from your norm. It can be your norm. But the difference between a disease and a disorder is really the lack of a clear cause. For example, an autoimmune disorder, it can cause a range of nonspecific symptoms like fatigue, fever, swollen glands, or digestive problems. But those are also symptoms of other conditions as well. Maybe you've got the flu. Who knows? More tests have to be done and are needed in order to identify the disease. So doctors may start out saying, oh, you've got some sort of disorder, but until they do more tests, they may not be able to identify the specific disease. Now let's zoom out a little bit more, and we are talking now about syndromes, which describe a collection of symptoms associated with a disease, but the cause is not well understood. So you could know the cause, but you might not understand why it turns out that way. So syndrome simply describes a constellation of symptoms that tend to occur together. Syndromes are often caused by the same things that cause diseases, but the specific causes of any particular syndrome aren't usually well understood. Autism is a disorder, which means it's expressed as a deviation from the norm being the rest of the public, but not necessarily the deviation from your own personal norm. Now, while there's no real definition for normal, we are in the minority as autistic people. So this is really about deviating from the majority. We also know it is genetic with hereditary components, and it is impacted by environmental factors. So it's more understood than a syndrome. However, there's no specific set of symptoms associated with the condition, which makes it difficult to diagnose. And while it can be diagnosed, the symptoms are subjective and nuanced, which is why it's a spectrum. In any case, it's still not considered a disease because diseases can be objectively measured apart from your normal state, and they can be treated, while autism is a spectrum disorder that is expressed in a wide variety of ways that may or may not be responsive to treatment. So we've discussed that autism is neurodevelopmental, meaning it affects the nervous system and is present at all stages of a person's life from conception to death. And we've discussed that autism is a disorder, meaning it is a deviation from the norms of society, but is difficult to measure and diagnose, and there is no defined treatment for it. Before I end this video, I'd like to mention one more thing. Autism is sometimes confused for a mental illness, but illness refers to the person's experience of poor health. So illness can include their physical discomfort that they feel, social disruptions, psychological impact, things of that nature. It's essentially how the person feels, whether the condition is diagnosed or not. Mental illnesses primarily impact mood, thought patterns, and behavior. Autism is not a mental illness, but is rather a difference in the structure and function of the nervous system. However, mental illnesses are commonly associated with autism because the nervous system impacts all of our senses. And when those are thrown off, it can really impact our ability to thrive. It can worsen our mood, it can alter our behavior. And after all, if your senses tell you that there is danger ahead, your behavior may be to avoid moving forward or toward that danger. The consequences of ignoring those messages may result in harmful thought patterns and even personal harm. So while autism is not an illness in itself, the way society is structured and how society responds to autism directly encourage the development of mental illnesses for autistic individuals. This is why so many of us are advocating for more understanding and acceptance, but it will also require changes in behavior of those around us. It's one thing to understand and accept someone's condition, but if you continue doing things to exacerbate it, you are knowingly causing harm. And if you're someone who claims to love an autistic person, but you refuse to consider their neurological differences and their sensitivities, it shows the autistic person that your love is conditional. It tells us that our feelings and experiences and our needs don't really matter. It tells us that you care more about yourself than you do about protecting us from harm. Now, imagine what that does to our mental health. Thank you for watching.